Hi, DrRodRohrich from Dallas, Texas, Rohrich Nose Podcast. Here's another series of Ask Dr. R. And today we're going to talk about the 10 most common post-op rhinoplasty questions that I hear and that my staff hears and that I get questions on social media. So let's dive in on rhinoplasty questions. Okay, of course, when will I see the final results? Well, I always say depends. If it's your first rhinoplasty, it should be 12 or 15 months. And of course, you'll see a lot of it in the first 6 months, but it depends upon your skin, the thickness of your skin, whether you're male or female. All those will tend to be, make it a little longer, and it's individual. But usually 12 to 15 months, but you'll see the results. A lot of it you'll see almost immediately, but the swelling will take place, and then you'll have to have that result. But everybody's different. So be patient. And I always tell patients, be patient. And then at 12 or 15 months, we'll see the final result. Will it be perfect? It'll be straighter, it'll be better, but it'll never be perfect. And then, how much pain will I have, and is this normal? Usually, with a rhinoplasty, you don't have that much discomfort after surgery, unless you're doing a lot of secondary surgery or a septal surgery. So if you have significant deviation and we have to fix your septum, which is that midline structure, you may have some discomfort, may even a headache the first night. But beyond that, the discomfort should be mild to modest. But again, everybody's different. It can vary. Most of the time, it's really not that much discomfort, but occasionally you'll have some, and that's why I give you my cell, and you can text me, and we give everybody some pain medications, and we can certainly add or subtract from that. So that is all normal. It usually subsides in 12, 24 hours significantly, but let me know. And then my nasal tip is asymmetric or swollen. Is this normal? The answer is 100% yes. I always tell patients, when I leave the operating room, it's as perfect as it can be. The nose, the dorsum, the tip, everything's symmetrical. Everything looks excellent. But then it's recovering. You'll have asymmetric swelling, that's all. And that's totally normal. And that can go back and forth for months, even up to a year. And sometimes, if the asymmetry is significant, then of course something may or may not need to be done. But that's really at 12 or 15 months. But everybody's asymmetrical. Nobody's totally symmetrical. Their face is not symmetrical. So this is normal, okay? And then, when can I have sex? When can I return to my normal workout? It's usually 4 weeks, okay? And I always tell people, if you want me to tell you some stories about going back before then, I can do that. And basically, it turns out to, a lot more swelling, bleeding, a lot of nasal bleeding, so don't do that. Don't do crazy stuff. So listen to me. And it normally, wound healing takes 4 weeks, so it's 42 to 60 days. So before you go back to your normal workout routine, and then start slow. Start very slow. Okay, so that's the most important thing. Know before you go. And then this is a very common thing. Is my smile is off. Sometimes I'm numb. That's pretty normal, especially if you have a deviated nose or you have something that was deviated in your septum. It's not uncommon that when we release that part of the septum right in front of your central part of your lip, that you may have a little bit of numbness in that area and your smile may be off. That's not uncommon. That'll come back, 6 weeks. Okay, not to worry. And also, if your nose droops down, there's a little muscle there called the depressor septi, which we partially release. That also will come back. Okay? Okay, next one is, when can I go back into the sun outdoors? Well, I always tell people you should always wear sunscreen anyway. So if you're going to go on a ski trip, don't do it for 6 weeks for many reasons. And certainly the sun and the energy of the outdoors, you have to wait 4 to 6 weeks. You have to be close to being healed. And wear sunscreen all the time on your nose, because your typical nose will be numb, so you're a little more susceptible to get a sunburn there because you won't notice it. Now, is it normal to have breathing problems right after my rhinoplasty? Absolutely. Even if I fixed your septum. When I take those splints out of your nose, those small little splints, not packing, you'll breathe amazingly well, but then your nose will swell up inside the mucosa. That takes time, and that's why you have to use nasal sprays, all those things we talk about, so that you can have your swelling go down. So again, that's normal. That can last weeks and weeks sometimes, depending on where you live as well. And if you live in a dry climate or in a high altitude, you're going to need to use a lot of moisturizing sprays to make sure you don't get any postoperative nasal bleeding or crusting. So this is also normal after surgery. And is it normal to have no feeling on the tip of my nose? The answer to that is yes, very, very normal. In fact, it's very common. It happens all the time, and it takes up to 6 months to get that back. So that feeling on the tip of the nose, it's normal because there's small little nerves there that have to be re-innervated in there when you come back. So again, that should come back in by 6 months. So what and when, if I need to desire a revision, when should I do it? Well, I always tell my patients, you know, your nose will be straighter, better. Will it ever be perfect? No, I've never done a perfect rhinoplasty, and I've done over 8,000, but it should be better. And if after 12 or 15 months in a primary and 2 years in a secondary, if you need a revision, of course, we can talk about it. And certainly, if I think something can be done that truly can help improve it, many times it's a minor procedure, I'll be happy to do that. And of course, that's something that we've already discussed preoperatively, and I'm happy to help you, because the goal in the end result is to have you be happy with your nose, both functionally and otherwise. So the goal is be patient, let the swelling go down, and then let's talk about it at a year after your primary and 2 years after your secondary. So, you know before you go. And the common bond here is, you know, you need to find an expert that does rhinoplasty. And I think that's probably the biggest byline here, is that the most successful determinant of your outcome in rhinoplasty is who you choose to have your rhinoplasty done by. So, and it should be chosen based upon you doing your homework. Find out if they're a real board-certified plastic surgeon, facial plastic surgeon, a rhinoplasty expert, how many they do, 2, 3, 10 a week, and that's very important. Look at their results, look at their online, look at their social media. So know before you go. That's the most important thing, but nobody's perfect. When can I go back to work without looking like I had a rhinoplasty? Usually I tell people in a couple of weeks. And again, it depends, but most of the time it's in 10, 14 days. And sometimes it's much earlier, sometimes it's later. But usually it's about 2 weeks, you know, as the outside bar, metric for that. And again, everything is different. If you have a secondary nose, a thicker skin, male, you may have a little more swelling. But most of the time you want to go back and it's not a problem. So those are the 10 most common questions that I receive both from my social media and from my staff that I hear about every day. So give me your comments, give me your thoughts. If we missed any questions that you may have, please DM me or give me a shout out on social media or my YouTube channel. I'll be happy to answer them for you. So hopefully this was helpful to you in becoming a more educated and better you when you're considering nasal or surgery or rhinoplasty.